injections and infusions. I had some help with this from Jo-Anne Sheehan. She was going to help us present. We're actually going to have her join us regularly to present, but her father-in-law is in the hospital right now, so that took precedence, understandably. So I'm going to try and go over her answer sheet she did for us. So this was the question. Hello, my employer wants me to start coding injections and infusions soon, and I want to learn as much as I can. I do have my CPC and my CCS, but I have not done this yet at the workplace. Is there something CCO offers? So first of all, thanks for thinking of us first for your educational needs. We don't really have anything kind of wrapped up, so hopefully this little segment will help you. And I'll pull up my answer sheet, very thorough, from Jo-Anne. So what she did is she took things from different sources and kind of came up with her own little cheat sheet. She did say to really make sure you check with your top payers that your practice is interfacing with to make sure these guidelines fit. So starting off with injections with E&M, this is an area that new coders tend to get a little confused on. So basically an E&M service is an integral component of diagnostic or therapeutic injection. Reimbursement for an E&M service is therefore included in the payment allowance for diagnostic and therapeutic injections. And it goes on, but here in bold, the injection code will be reimbursed unless a significant and separately identifiable E&M service has been performed. If that's the case, then modifier 25 should be appended to the E&M code, and both the E&M code and injection service will be reimbursed. Okay, so my little rhyme that I teach during my coding course or the Blitz is if you don't have a HEM, history, exam, medical decision making, you can't bill an E&M. So look at your source document. Do you see history clearly documented, an exam clearly documented, and medical decision making clearly documented, in addition to, in this case, an injection or infusion note? Then you can bill both. If you don't, and it's all just about the injection, then just bill the injection. Okay? Now, there are some exceptions. Preventative medicine, E&M codes, the 99381 to the 99429 code include routine services such as the ordering of immunizations or diagnostic procedures, which are not considered included in the preventative E&M service. Preventative E&M codes may therefore be reported in conjunction with injection service codes, but modifier 25 is not needed on those. I kind of view modifier 25 as regular E&M codes, not the like preventative medicine ones. And by regular, I mean the HEM-based ones, history, exam, medical decision making. They got those 3 bullets in them. Then an E&M code with 99211. 99211 is what's referred to as the nurse visit code. It's that 5-minute quickie code. That will not be reimbursed when submitted with an injection code. So, injections and medications. Medications provided at the time of diagnostic and therapeutic injection should be reported. When I teach this in the medicine section, I call it stick and stuff. And that helped me when I was new at coding to remember that when you're talking about injections, there's normally 2 pieces to the story. What you're injecting into the patient and the service of sticking it to them. So if that helps, just think stick and stuff, or what they call administration and the product. And so this is just that reminder permission statement that you can bill for the product separately. Supplies, injection and infusion services and supplies, standard tubing, syringes, and other supplies are included in the injection infusion service code. So you don't want to try and bill for them separately, and they're considered incidental. So therefore, supply codes submitted with codes for the following services will not be separately reimbursed when submitted by the same physician or other healthcare professional. And injection and infusion services include the injections themselves, hydration, sometimes they have to put saline in, therapeutic, prophylactic, and diagnostic infusions, chemotherapy, and other highly complex drug or highly complex biologic agent administration. The specific CPT codes associated with injections and infusions provide very specific guidelines for initial use in each additional hour. So be led by what CPT is telling you for how to code the initial hour and subsequent ones. And if they're doing concurrent infusions, it's all laid out right there in CPT. And the last point is to remember that these guidelines represent many payers, so it's always in the best interest of the provider to verify coverage and coding guidelines for the specific payers that you're associated with. I normally recommend calling your top 4 and making a note of what they say on how to handle that. And do that for any particular thing that you're researching that's popular in your practice. So hopefully that will help. I noticed in the chat too, people are asking about these answer sheets and the slides. For this live free webinar, we don't provide, I mean, we'll give you links here and there, but for the most part, we're developing these answer sheets for our Replay Club members. Our Replay Club is $19.95 a month, and you can cancel at any time, and we provide a full recording of this webinar broken into the segments, the little video clips of each topic, so it's real easy to drill down and get to what you want. And then all these answer sheets are a nice, pretty PDF format that, again, Ruth is an integral part of putting together.
Need more medical certification training? Go to www.codingcertification.org.